This presentation is entitled Pain, Anxiety, and Additional Holistic Benefits, Reconnective Healing by Wendy Edwards at Regis College. So what is reconnective healing? I, as a practitioner, am interested in biofield therapies and the results of the research concerning them. Reconnected healing is such a therapy. It's a biofield therapy, similar to Reiki, therapeutic touch, and healing touch. It was discovered and developed by Dr. Eric Pearl in the early 1990s, and he claims that over 100,000 people are trained in this particular modality over 5 different continents. He also says that 20 to 30% are professional healthcare providers and provide this therapy in their practice. So what is it? A biofield therapy is where the interaction of a healer and a healee, their biofields interact. And there is a healing intention given from the healer to the healee, which is intended to change cellular function, relieve emotional burden, and diminish pain. Healing occurs naturally. The healer doesn't actually heal the patient's body heals itself as a result of the healer and healee interaction. Practitioners train to use their hands to sense and alter these different biofields. Practitioners tune in to the healing energy frequencies needed by each recipient, and so it's unique to each person receiving and sensing the energy for that particular session. From the words of Dr. Pearl, he says reconnective healing is not just energy healing, but instead a more comprehensive spectrum of healing composed of energy, light, and information. It is not something we do, it is something we allow, become, catalyze, and help facilitate. So what is the biofield? Maybe a little more details might help. According to the National Institute of Health conference in 1992, they said that it was a massless field, not necessarily electromagnetic, and that it surrounded and permeated living bodies and affected the body. It's also described as an endogenously generated field, which may play a significant role in information transfer processes that contribute to an individual's state of mental, emotional, physical, and spiritual well-being. If these definitions are accurate, then it seems like the biofield is very important to health and healing, and nurses should know about it. Although Western medicine does not acknowledge biofield therapies or biofields, the balance or imbalance of a biofield, over 1.6 million adults in 2012 reported using a biofield therapy. It is non-invasive. As explained earlier, the practitioner explicitly entangles within a client's biofield to stimulate healing response. There's many different kinds of techniques that all do this, and no matter the technique, they all seem to produce healing. It can be practiced in person or by distance, sometimes even thousands of miles from the practitioner. It's been practiced in Eastern and Western cultures for thousands of years. Some of the examples are cultural medicine men or the laying on of hands in the Christian religion. This is a featured research article that I wanted to share about reconnective healing. It was a very interesting article because it wanted to compare people, the standard for those with restricted shoulder mobility and who received the standard of care, which is physical therapy, with a different modality that manipulated the biofields. Which is very interesting because one is total hands-on, where the structures of the shoulder are stretched physically, and the other is where the patient isn't even touched at all by the practitioner. The reason why this study was brought about was because in the physical therapy profession, there's a lot of work-related injuries as they manipulate their patients with force. And so this study was done by the University of Arizona Departments of Physiology, Medicine, and Psychology to see if there is a better way to treat these patients so that they could avoid work-related injuries. I loved that point of view. It was to actually look to improve their standard of practice, looking to these modalities maybe for an answer. It was a quantitative study with 4 blind groups and no treatment control group. So it's the design of this study seemed very solid. The 4 blind groups were physical therapy, so the standard therapy, the gold standard, Reiki, which is another biofield therapy, reconnective healing, which we have discussed already, a sham treatment, which is where a practitioner or somebody just goes through the motions without healing intention, without training, and then a no treatment control group. The results of this study were astounding to me. We have the physical therapy. Let me explain a little bit more about what we're looking at. The range of motion is described in degrees. So the physical therapy, those patients who received physical therapy increased the range of motion through physical manipulation about 13 degrees. The green is decreased pain, and this was a percentage. So the decreased pain was decreased in physical therapy after the manipulation. I'm sure it was painful during the manipulation, but after the manipulation was decreased about 12%. Now, if we go to Reiki, the increase in mobility was almost double that of physical manipulation, and the decrease in pain wasn't quite as good as physical therapy. But the astounding part is the reconnective healing, where the range of motion was increased by about 27 degrees. That's significant. And also, keep in mind, these patients have had a restrictive shoulder for greater than a year. But pain also was decreased, if you can see on this chart, for about 23%, which is amazing. Another thing I want to point out here is that the sham treatment also had greater healing improvement than the physical therapy, which the authors point out is probably a part of, they call it the placebo response. Well, we know that the placebo response is an actual response. Something actually is happening, even though the sham treatment maybe had no desire or no intention of increasing the range of motion. The patient still responded by decreased pain. So even when the intention is not there, the patients receive some sort of benefit. The psychobiological mechanism of action is theoretical. Pain and anxiety relief through biofield therapy is thought to happen because of presence, support, touch, attention, skill, and healing intention. However, that doesn't explain what's really happening. Many theorists have thought and tried to explain that biofield therapy affects the whole person, and so therefore there can be outcomes both known and unknown, and biofield therapies are affecting physiological processes that are not being monitored because it affects everything. Everything's related to everything else. So as the mind and the body are being treated by this holistic therapy, many things are occurring, not just the particular focus. So what were the benefits of reconnective healing according to the research article that we just reviewed? Well, according to the patient's report, they received relaxation, mental clarity, pain relief, decreased anxiety, sense of well-being, which all of those things are very general but global. Physiologically, the authors state that they believe that the range of motion was increased by an autonomic activation, a concomitant vasodilatation, smooth muscle relaxation, increased blood flow resulted in improved range of motion, decrease in pain perception, and changes in the tissue. That is the conclusion of this presentation. Thank you so much for watching.